Welcome everyone to this session. My name is Zach Erston, and I'm the technical manager. This is the Learning Lab application of a common approach to measure the costs and benefits for an agriculture, nutrition, and health program, project, or intervention. That's chaired by Carol Levin. Thank you for taking part in ANH 2021, and we look forward to a robust and interactive session today. A quick reminder that everything that you might need to access for this learning lab or other conference materials, they can be found on our website, which is anh-academy.org/ANH2021. So before Carol takes the conversation forward, I just have a few technical announcements to ensure our experience is as smooth and interactive as possible. This session will be recorded and posted on the ANH Academy website following the conference. Second, all participants have been muted, but we encourage you to introduce yourselves using the chat function. So let us know your name, where you're joining us from, and the organization that you work with. We encourage you to share your webcam during the session, but if your connection is a little faulty, we recommend that you do turn your video off. Later on in the session, we'll be breaking up into breakout groups. If you have any questions as we go through the session, please use the chat box to write your question in, and the Learning Lab facilitators will do their best to address them during the session. And then if you have any technical issues, do check your audio settings and internet connection. And if you need to, you can always leave the session and come right back in using the exact same Zoom link. If you have a question, feel free to send me a private message in the chat box. So without further ado, I'm going to hand it back over to Carol to start the session. Thanks so much.
Thank you, Zach, and thank you to all of the ANH organizers for giving us the opportunity to be together today. So welcome to the third ANH Academy Learning Lab that explores concepts and practices related to economic evaluation of agriculture, nutrition, and health programs. We are delighted to have you joining us. It's my pleasure to introduce your facilitators to start with, and I'd like to just ask each facilitator today to please introduce themselves, where they work, and if they've conducted one or more costing studies, to tell you where they've conducted them. I'll go ahead and start. My name is Carol Levin. I am an agricultural and health economist and a clinical associate professor at the University of Washington in the Department of Global Health. I've conducted over 25 costing studies and economic evaluations, and probably the most I've conducted are in the country of Kenya. Let me invite Christopher Kemp to introduce himself, and we'll just go along the slides today.
Hi, everybody. Nice to meet you. I'm Chris. I just joined Johns Hopkins University as faculty 2 weeks ago. Before that, I was at the University of Washington, where I've been working with Carol for the last 2 years, and specifically leading the costing of the Suahara 2 multi-sector nutrition program in Nepal. Nice to meet you.
Esther.
Hi, everyone. I'm Esther Chu. I also work on the SEAMS nutrition team as part of the University of Washington. I've worked on several costing studies in Kenya, from RCTs to larger multi-sectoral nutrition programs. Happy to be here with you.
Hello.
We missed Johnny, Carol.
Oh, I did. Johnny. Oh, my eyes are terrible, Johnny.
Sorry. Hi, I'm Johnny Crawford, and I'm a postdoctoral researcher at the University of Washington. Welcome to the session. I've done a handful of costing studies in Ghana, Ethiopia, and Mozambique primarily.
Thank you, Johnny. Aulo.
Hello, everyone. I'm Aulo. I'm a senior research fellow at IFPRI in the Poverty, Health, and Nutrition Division. So I'm a nutrition epidemiologist. And I first started working on costs back in 2004, 2005, working across countries with WFP and school meal programs. And since then, I've learned a lot from Carol and the UW team, working a lot in the Malawi and Burkina Faso settings. Thank you.
Amy.
Hi, everyone. My name is Amy Margolies. I'm a consultant working with, on the IFPRI side, but working with the University of Washington on this SEAMS nutrition project. I've been working on costing since, I think, 2010, when I started at IFPRI as a Mickey Leland International Hunger Fellow. working with the World Food Program on costing food transfers versus alternatives. And so it's been really great to continue that work through this project. Thanks.
And Hassan.
Hi everyone, I'm Hassan Akparaspitgoli. I'm Health Economics based on UCL, University College London, Center for Global Health Economics. And I started doing costing since 2001 when I was in budget department doing budgeting and costing. And then recently, since joining UCL, doing a lot of costing of trials since 2012, and across disease, and then mostly NCD nutrition. And recently I work on ALPA-1. It's based on India and is agricultural nutrition intervention. And I work across mostly South Asia and Kenya and Uganda. Yeah.
Thank you so much. So participants, I thought we had maybe 30 years of experience in costing and economic evaluation, but probably we have closer to 50. So we are thrilled to be here today. What we'd like to do, obviously we're too big of a group to introduce ourselves, but I'd like to try something with you all, if you would indulge me. So those of you that have cameras that work, I can see that most of you have got your cameras off. So I'm going to challenge you to, let's do a small exercise. Keep your cameras off. And would you turn your camera on if you are predominantly a researcher in your field? Turn your camera on. We'd like to see your faces, or put your hand up. So if you're a researcher, put that camera on, and you can put it right off in a moment. I'll give you a minute to put that camera on if you're a researcher. Are you a researcher? Put your camera on. Great. Now, turn your camera off again. And if you're an implementer, you predominantly are implementing agriculture and health interventions in yours or other settings, turn your camera on if you're an implementer. Great. So we've got mostly researchers in this group and a handful of implementers. How about, have you ever, if you have ever conducted a cost analysis or economic evaluation, turn your camera on. Turn your camera on if you have ever, or raise your hand, use the symbols at the bottom. Have you ever conducted a cost? All right, so we've got a lot of learning to do together. And finally, this is important. So if you took a learning lab with ANH Academy last year or the year before, can you please turn your camera on? So, all right. Well, welcome everybody then. Thank you so much for participating in this. Now, there were some prerequisites for this learning lab, and so we do hope that you spent some time reviewing the materials as a prerequisite, because today we're going to jump right into a hands-on experience of using some of the economic tools that we've developed as part of costing tools that we've developed as part of SEAMS Nutrition. We will have a plenary session where we'll give you an overview of our approach and introduce a SEAMS Nutrition training website, which we do hope many of you have already seen. We will then talk about study design and how to align your project or program's activities to our SEAMS Nutrition framework. We'll introduce the hands-on group activity. We will have small group activity. We have 7 facilitators, so you'll really have an opportunity to work closely with one expert in costing and economic evaluation, and then we'll come back to plenary. Before we begin, I'd like you to either put your response in the chat box, raise a hand, or turn on your camera. Were you able to access the SEAMS Nutrition website? We would like to see a response in the chat box, a yes, a no, or raise your hand if you were able to access the materials on the training website. So we've got one thumbs up. We've got lots of yeses there. Wonderful to see it. Glad to see it. Were you able to download and open the 2 training material documents that are essential for this training website? If not, we'll have a little bit of a trouble in the small. Okay, so no, unfortunately you had a, okay, so not too low, not too late. So what we're going to do now is we're going to ask you, Esther is going to drop in 2 links. She's just dropped in a link to a semi-structured interview guide and to a financial expenditure analysis tool. Please open these links on your own computer and download them onto your own computer. If you have any trouble accessing them, please, or downloading them, please put a note in the Dropbox. This is really important for our small group work. Any questions before we begin about prerequisites or materials for this training workshop? Any questions? Okay, well, if there are no questions, then I'd like to welcome you all again, and I'm going to invite our first speaker, Dr. Christopher Kemp, to provide an overview of the SEAMS Nutrition approach and tools and introduction to the SEAMS Nutrition training website. Over to you, Chris.
Thanks, Carol. Can you see that okay?
Yes.
All right, so you can see just my full slides?
Yep.
Okay,
Yes.
Great. So hi, everyone. So I'm thrilled that you're all interested in costing and economic evaluation. The first step to our learning lab today is to give you a brief introduction to our approach to thinking about designing and implementing a costing study. And we're going to align this discussion to a set of tools that we've developed to help facilitate that process for you, tools which are freely available, which we'll introduce through the course of this learning lab, and which you can adapt for your needs. We think that collecting and analyzing cost data from these large, complex, nutrition-sensitive programs is a unique process, but we hope that this introduction will make this achievable and approachable for you. So our project is called the Strengthening Economic Evaluation for Multisectoral Strategies for Nutrition, or SEAMS Nutrition Project, which was developed in response to a need for higher quality cost and affordability data for nutrition sensitive interventions. It's a collaboration with a lot of folks that you'll see on the bottom. And ultimately, our goal is to define a set of appropriate and standardized methods, or what we're calling a common approach to measuring cost and cost effectiveness of integrated nutrition sensitive programs, and then to apply that approach to a series of integrated multisectoral nutrition programs in several lower middle income countries. So to support investigators to design and implement costing studies, we've delineated a set of standard costing steps and tools to support you along each step. These tools are freely available for any project to use and adapt as you'd like. So the first step is obviously to design a costing study. We have developed a matrix, an economic evaluation matrix, which helps you define the parameters and scope of your study. And we've also developed a generic costing protocol, which delineates some of the common data collection methods, data analysis methods, analytic approaches, ethical issues, and other things that you need to consider when you're designing your study, and text which you can use when you are writing up your own protocol. The second step is to understand the specific activities that constitute your program. So we've developed a project activity tracking sheet, which helps you to really clearly delineate and describe the specific activities that form the basis of the program that you're costing, and then to map these, this is important, to a series of standardized activity codes, and basically to categorize your activities and your intervention in a standardized way, which helps improve the comparability of your findings eventually against other complex programs. It also helps you identify the sources of costs for each of your activities that you're going to measure over the course of the project. Most costing studies will include some form of qualitative microcosting to understand total economic cost, which would include volunteer time and out-of-pocket expense, as well as to understand how staff allocate their time to various activities or other shared costs across various activities. we have developed a set of generic data collection and analysis tools for this purpose, for the qualitative data collection portion. We've also been lucky enough that for all of our costing studies, our implementing partners have been large international NGOs or large national NGOs, and have been willing to share expenditure data to allow us to directly estimate and understand the financial cost of implementing each program. And so what we've done is developed a generic financial expenditure analysis tool, which you can use to similarly analyze raw expenditure data. Finally, second to last, we've developed a spreadsheet model for extrapolating from qualitative data to a total economic cost estimate. And finally, a spreadsheet which allows you to combine the financial and the economic cost estimates into a single total cost. So all of these tools, like Carol has said, are available for your use and adaptation on the SEAMS Nutrition website. The link is here. It's also been posted in the chat. So we'll walk through just a quick example to give you an idea of how this works. So let's imagine we're setting out to cost a very large, very complex multi-sector nutrition program in, let's say, a West African country. This program combines a series of nutrition-specific and nutrition-sensitive interventions from 3 sectors: health, education, and agriculture, as well as a governance component, which is really about improving the enabling environment for multi-sector nutrition. The interventions include behavior change, some work with the education sector around healthy behaviors, and then homestead food production and poultry promotion. So the first step would be to define the scope and parameters of your study. There's a series of issues that you need to think about when you are designing your costing and full economic evaluation study, including what is the perspective of the cost that you care about? Do you care about only costs borne by the donor or by the government? Do you care about the full societal cost, which is the traditional emphasis of economic evaluation? What are the study design approaches you're going to use? And this will depend on the data sources you have access to. Are you going to micro cost, meaning you are going to use qualitative and mixed methods approaches to directly understand to estimate the cost directly, or are you going to use raw expenditure data to understand the financial cost? How are you going to sample? And of course, the time horizon. So for the time horizon, I'm talking about essentially the scope of cost that you want to consider. The protocol helps you put all of that down onto paper. So it forces you to describe in detail the objectives of your costing study, the approach, data collection, the sampling strategy, how you're going to analyze your data, and includes some text around how to manage data and ethical considerations associated with costing. So like I said, it's really important that you clearly delineate your project-specific set of activities or evidence-based interventions, align them to a typology, generic typology of interventions. We've developed one that helps compare across complex multi-sector nutrition programs, and then even beyond that, to delineate the specific set of activities that form the basis for that form those interventions, and then to understand where the costs from each of those activities will be, how you're going to estimate the costs associated with each of those interventions. Most projects that you'll work with will have developed a program impact pathway or a logic model, which describes how they plan to get from their activities to their impact. And we suggest that you use that, but think about how the specific activities could align to a generic typology of nutrition sensitive and nutrition specific interventions, and think about the specific pathway or even the specific sector that each intervention is mapping to. So this is a very highly simplified version of a potential program impact pathway for our hypothetical West African multi-sector nutrition program. This is an example of what your project activity tracking sheet could look like. So under the agriculture sector activities, under the homestead food production activities, you might identify a set of activities that take place at the beginning of the project, including recruiting staff, orienting staff to the project, conducting initial workshops, developing training materials, and then the set of recurrent activities, which might include distributing crops or chickens or other things, and visiting and monitoring homestead food production in the field. So for each of these, you would identify a time period, you'd identify the source of your data, whether it's going to be coming from the costing data is going to come from expenditure data or from qualitative data. And you align each of those activities to a set of standardized codes that our project has developed to help you improve the comparability of your findings. So qualitative data collection is a really important step that you'll almost certainly use. We'll use interviews, focus group discussions, and observation to understand the attendance rate of project activities, the frequency and duration of those activities, any out-of-pocket expenses, for example, travel costs, opportunity costs like missed wages at work or paying for childcare that even your project beneficiaries might be paying in a sense to participate in the intervention activities. We have a lot of generic interview and focus group discussion guides available for you to start adapting for your setting. Some of these target project beneficiaries, some of them target frontline staff or national level program staff, government staff. Generally, they ask all about the same things. They ask about activity participation, duration, travel, expenses, and other things that participants might have missed out on in order to participate. And there are links here to 3 of the specific tools that we have available. So quick opportunity for some response from you all in the chat box. If you're thinking about the potential costing this West African multi-sector nutrition program, what do you think are some of the potential costs to beneficiaries for participating in the model farm program to promote diversity of homestead agricultural production? So what are some of the potential costs that beneficiaries might face in order to participate? I'm trying to see the chat box, but I can't with my screens up like this. Can someone else call out any responses that they see? Carol, maybe?
Sure, yeah, I'm happy to. Hang on, I've got to find my chat box. Hang on, come on. Yes, so we have time. Labor.
Yeah. Volunteer and hired.
Farm inputs. Loss of crops they would otherwise plant.
That's great. Yeah. That's perfect. That I mean, almost aligns perfectly with what I was thinking. So, you know, people put in time, they put in labor. Of course, they have to invest to build up their crops on their own, and they may have planted something else that might be equally or more valuable, right? And so these would be some of the things we would estimate.
And we got transport and opportunity costs, other things they can't do.
Great, thank you. So another use for the qualitative data is to understand how staff spend their time across project activities. We're going to talk about this specifically in the Learning Lab today. This actually comes from the Upavan trial, this tool. And so you'll hear a little bit more about this in a second, but basically we can use qualitative data to allocate shared salary costs across multiple activities. And if you're lucky enough to have access to direct financial data, you can use this expenditure analysis form, this template, which is done in Excel. We try to keep it as simple as possible, but it allows you to take raw expenditure data, which would be, you know, an Excel spreadsheet or some other data set that you have that includes the date of an individual expense, the amount of the expense in a local currency or in US dollars or in some other currency, and the description of the expense. And it may have other codes. It may have budgetary codes and other things that are assigned by the implementing organization to individual expenses as they keep track of their own expenses. And you can use those codes, the description, to understand what the expense was and to code it on the basis of an activity, but also on the basis of an input type, which is really important. Thinking about the distinction between salary expenses, capital expenses, supplies, etc. And this spreadsheet helps you do currency conversion. It helps you annualize your expenses and then summarize them. So here you might imagine, you know, a 500,000 rupee expense on a vehicle. The spreadsheet automatically converts that to a US currency for a specific year. You can code it as a capital goods expense. You can code it. You know that this is using your qualitative data. This CAR is always used for inputs distribution, and you can annualize the expense and allocate it to specific years to smooth out the expense over the course of the project. And the spreadsheet, the expenditure analysis tool, gives you automatic tables and figures that help you summarize your costs, your financial costs on the basis of input, activity, overtime, etc. This is a little bit complicated, trying to understand how to estimate economic costs from a set of qualitative data, but I'll go through it very quickly. I realize I'm probably going slightly over time, but essentially what you're trying to do is estimate for an individual person or for a set of people that you've interviewed, the amount of time they spend in project activities, their out-of-pocket expense, and their opportunity cost. You can total that up, and you can actually use local wage rates and other ways to estimate the value of people's time. And of course, the opportunity cost and the out-of-pocket expense are directly estimated in a currency amount. And then you can extrapolate up. So if you know, okay, I've interviewed 10 project beneficiaries, but there were 1,000 overall. If you think that your 10 project beneficiaries gave you a valid estimate for the distribution of costs faced by the 1,000 people, you can multiply and always include some uncertainty in those estimates to arrive at a total economic cost for that type of person. And so here is a sample spreadsheet that shows how we do this for project beneficiaries for one project. We break it out by activities. So we think about the average time spent in specific activities, traveling to those activities by month, and the hourly wage that those people would otherwise be paid for their time in that community, which is another data source that we try to get in our projects, plus their total out-of-pocket expense, and then we total it up on a monthly basis. And then finally, you take the two financial cost estimates and the economic cost estimates, pool them together. You can do this on the basis of their input type or their activity type and arrive at a total cost estimate for the project. And then most importantly, you start to understand and standardize that estimate by dividing it, for example, by the total number of beneficiaries reached. And eventually, if you have a full impact evaluation conducted and you have estimates of the benefits of the intervention, then you divide by those benefits to understand the economic, the cost effectiveness, the benefit cost, et cetera. So the cost per case of stunting averted, for example, or the cost per death averted. You can even stratify these estimates, and this is quite important. Thinking about if you're able to use your sampling approaches to stratify your cost estimates on the basis of some important characteristics like rural versus urban implementation setting, and then you know the total number of beneficiaries or the relative effectiveness in those two settings, then you can generate stratified cost effectiveness and cost efficiency estimates, which is highly useful in the sense that some settings are much more expensive to implement than others. So thank you so much. If you're interested in the application of these methods, we are giving a research talk next Wednesday with the details here. Thank you.
Thank you so much, Chris. All of the materials and a more detailed training video are available on our training website as well. And this will be available after the meeting, of course. Amy, I'd like to introduce you now for the second plenary session, Study Design, Aligning Your Project Activities to the SEAM Nutrition Framework. Over to you.
Great, thank you, Carol. Hold on one second while I pull up the presentation. Can everyone see that?
Yes, we can. Thank you.
Great. One moment. Okay, so I'm going to dive a little deeper. One of the activities for going through the SEAMS nutrition process that is aligning project activities to our framework. And you may be asking, what does kind of mapping have to do with all of this? What does that mean? So to get started, we're taking this common approach. And I'm going to start by explaining the purpose and process of activity and input mapping, and then use an example from 2 actual interventions to show how this works in practice. So why is this alignment to standard categories so important? So as Chris introduced, we're really working toward standardization. So we want to achieve standard outputs, outcomes, and unit costs. So we know we have these challenges of multi-sectoral programs that are quite different. They may have different activities. For example, an aquaculture-based program versus agriculture-based. They may have different entry points or delivery platforms, for example, microfinance versus early childhood development, and they may come from very different country contexts. So we would like to move toward these standard approach to be able to make comparisons and look at these different interventions and see how they stack up cost-wise. So the SEAMS process, as Chris also introduced, this is kind of a nice visual to show you how it works. And we're using both costs captured by expenditure reports and non-expenditure based costs, as he was introducing those economic costs, and combining them together for a full economic evaluation. So throughout this whole process, we're allocating costs by activity and input. This allows us to make comparisons, better understand the costs and how they align to those program impact pathways for your unique intervention. So first step we developed during this standard approach were standard activity cost categories. So your intervention or your program may have very specific and unique activities as part of the intervention, but in general, we've found that there are common buckets of activities that different intervention activities can be aligned with. So we began by developing these cost categories and dividing them between startup and recurrent costs. So startup costs being those that are necessary as the program is being started, for example, within the first 6 months, and they're kind of a one-off activity, such as a training of trainers or initial materials development for behavior communication change. And then those recurrent activities that are basically the ongoing program activities done by staff or frontline workers, such as home visits and supervision. We do have a lot of resources Carol was explaining on our website and with our tools where you can spend more time looking at the specific definitions of these activity categories. We try to include a lot of examples so you can really make it work for the program that you're investigating. So there's lots more you can look into there on your own. So now we're really asking the question, how do you take your program activities and inputs and align them with the standard categories? Because of course you're probably thinking, okay, my program, I don't really understand how it applies. So we're going to take some real life examples from Malawi and Bangladesh. And just to quickly introduce these two interventions, Malawi, it was called the NIPI program implemented by Save the Children. The entry point for this program, it was an agriculture nutrition intervention delivered through community-based preschools. So there were agricultural components, nutrition BCC, there was meal preparation at the community level. And then in Bangladesh, there was a program that was implemented through a microfinance entry point, and it was an additive design that included nutrition behavior communication change, nutrition sensitive agriculture, as well as gender sensitization. So the first step is basically to start this mapping process. So you take the program activities from your project and determine when did they happen and how often. So here on the left, you see this kind of cheesy bucket of activities. And these are all the activities that your intervention involves to be implemented. So here we could see there's some nutrition BCC, and you're looking at those program categories here saying, okay, nutrition BCC, was that a one-time activity or was it recurrent? So that's probably a recurrent activity. And where does this fit in our standard SEAMS categories? And that would fit under training. So that's just one example. And basically you're going to go through all your program activities and mapping them to these standard categories. And again, the purpose of this is so that when you get to the point where you can do like a pie chart or a breakdown of those costs, you can really stand it next to other interventions and understand the cost drivers and how it compares to other interventions. So there is an ultimate purpose here that is worth doing all this initial upfront work. You do the same for all program inputs and resources. So that could be you see here volunteer and paid labor are assigned personnel inputs, and school meal or food preparation inputs are under supplies. So you keep mapping until you've coded all those inputs and activities to the SEAMS standard categories. So it does take some time, but ultimately you have a result of your hard work, which is you have all the costs coded to standard activity and input categories. You have standardized categorization, which allows for comparison across these diverse programs. So let's see some results from these different interventions. So here we see that for example, in Bangladesh, we see activity cost drivers broken down. So we see that household nutrition counseling is one of the primary drivers of cost. In comparison, in the Malawi intervention, we see that training was really driving those costs, and then school meals as well. And so this tells us a lot about the different interventions and where the cost drivers are occurring. And it's very useful, I think, also for implementers and researchers to understand how those costs are broken down. We can also, since we've done the coding by input as well, we can also look at what are the cost input drivers and see that, pretty consistently across all these types of interventions, personnel is almost uniformly the greatest driver of input costs. But it also tells you, look, supplies could be another one, travel. You can also identify here where you may have an expensive cost input category, and it may be helpful for implementers to identify that. Now, the next step is a little more unique. You map your costs according to a nutrition sensitive value chain typology. So we're going back to those program impact pathways for your intervention, charting those pathways through which impact is occurring for your unique intervention, and tracing the flow of program resources to the activities linked to the pathways. So it's kind of saying, all right, we're doing some agricultural extension support. That's taking you from improving farming knowledge to farming practices and ultimately increasing production. Or on the demand side pathway, you're moving from nutrition knowledge to practices to nutrition status. So again, an example here of the two programs. You see Malawi here on the left and Bangladesh on the right. You're mapping through these impact pathways, so it's slightly different. So going from increasing supply activities, and again, these are applying these same standardized categories. And it's interesting to see that there are actually a lot of commonalities between the programs, even though at a distance they seem quite distinct. And when we actually generate the nice pie charts at the end, it's really interesting to see they're both demand pathway driven interventions, and actually the cost breakdown is almost identical between the two programs. So to highlight here the advantages of our common approach, it allows us to generate estimates of unit cost that are comparable across very diverse and complex programs. It allows us to disaggregate by input and activity for robust assessment of those cost drivers, so that can be really useful for both researchers and implementers. And these generic tools lower the bar to the integration of costing in multi-sectoral nutrition program evaluation, which has been a challenge in the past. Thanks so much.
Thank you, Amy. Thank you so much. We are running a little behind schedule, so I want to check in with my facilitators. Shall we jump into our small group work? And maybe I can really go quickly over some of the points I wanted to make in the third presentation, but facilitators, can we just take a pause here? Excuse me, participants, as we want to maximize your participation in this learning lab. Thoughts by my co-facilitators, because we're at, basically we're at 8:15 and we wanted to allow 40 minutes. We could reduce that to 30, but what do y'all think?
Carol, I think if you do a quick introduction and then we can quickly go into the breakout.
Okay, let me do that then. Give me a moment, folks, while I share my screen. Okay. let's get, let me go ahead and. So again, you've heard two presentations from Chris and from Amy, and you might be thinking, this is all great, but how do I do this? And so the intent of our this hands-on session, we'll go over some learning labs. We want to focus on two tools today. We want to highlight, if nothing else today, we want you to go away with this understanding that we use these mixed methods in cost data collection. And today, because of our time limitations, we're going to focus on collecting financial costs only. So we're not looking at economic costs, and we're not diving into how to value benefits or how to combine benefits and costs. Time permitting, we will go over time allocation data and the introduction to a semi-structured interview guide. And we'll also show you how to link that time allocation data to a financial expenditure tool. Now, you'll recall that Chris went over these sets of tools. As I mentioned today, we're focusing on two of the tools, the focus group and the key informant interview guide, and the estimating financial costs using the expenditure analysis model. Now, I wanted to say a word about mixed methods. So, as many of you may know, as researchers, we tend to evaluate effectiveness or impact of multi-sectoral nutrition programs that are typically funded by donors or external global projects. Sometimes we evaluate randomized controlled trials, and often we're looking at the performance and impact of national government programs. But all this to say, when we are working with organizations that have external funding, we often have access to financial expense reports. So in that case, we may be wanting to use financial expenditure data. If we're costing a purely government program, we might want to use a micro costing. I'm not going to have time to go over these slides in detail, but know that we're going to share these slides with you, and you can look at some of the advantages and disadvantages of what's called gross costing or using financial expenditure data. Similarly, I'd like to invite you to review slides on micro costing methods, which means you collect the actual quantities and prices of all resources used for a project and for each activity. Again, I'm not going to go over these advantages and disadvantages, but I'd like you to know that these slides will be shared and you can look at them yourself. Typically, we must use microcosting when using a government-funded program. Now, the truth is, we in almost all programs, we use some blend of mixed methods. So remember the slide that Amy showed you that shows financial costs in gray in this diagram, and economic costs, which means opportunity costs. Many of you mentioned that in your the chat box. And so gross costing, or using expenditure data, financial expenditure data, is used to capture financial costs. Micro costing is typically used to capture economic costs. We also need to sometimes look at how staff time is used for financial costs, in which case we use semi-structured interviews to capture information on how frontline workers and staff working at the government level or international NGOs spend their time. Today, I want to be very clear that when we go into our breakout groups, we will be focusing on financial expenditure data. We would love to do everything, but time doesn't allow us to. And so we're going to jump into that now. Welcome back, everyone. So how many people were able, raise your hand if your group was able to get through all of the exercises? This probably needed to be a 3-hour learning lab, but we'd have lost you all. It would be good to, so X, Johnny, okay, facilitators, put up okay, all right, so friends, we've tried to share with you these tools I'm not sure how far you got with them, but now you know where they are, you know how to access them, you've seen some filling in. Hopefully all of you got to the Excel file. So very quickly, what we have 10 minutes to go, is that right? Wait, no. What time does this end, Zach?
You've got 40,
Yes.
10 minutes.
10
isn't it?
minutes
Yeah.
to go.
Okay, great. So
Can I just add something really quick, Carol?
Yeah, sure.
Perhaps my group was working on the exercise, but they didn't see the answers. Are we going to make sure we share those answers so everyone can see them?
Well, yeah, why don't we put the answer Excel spreadsheet, a link to it? Esther, are you able to, I don't know if the answer spreadsheets are, we're not going to show them now, but what we can do is make them available in a link. Esther, if you can upload them to a Google Drive. Thank you. So Esther will be putting the link to the answers. What we didn't get to show to you many is there is a tab on the worksheet called base summary. And what it automatically will generate, if you go through this process of coding the line items, it will automatically generate costs and cost shares by input categories, which you can see an example of here. It will automatically analyze costs and cost shares by activity using the Seams Nutrition activity codes. And then, of course, once you have your total cost, you can generate unit costs by combining your total cost data with information gathered from your monitoring and evaluation on your outputs of interest. These may be household visits. These may be the number of pregnant women reached. They may be the number of children under 2 years reached. So you've generated, for instance, an estimate. Well, it's 13,472. In my example, let's say the total cost is 12,380, and simply dividing the total cost by the different metrics of interest gives you what's called a unit cost. Please note that you can have many different types of unit costs as shown here.
Sorry to interrupt. I just
yes.
wanted to let you know it's 40 minutes to go and not 10.
Oh, we have 40 minutes.
Yeah, because we're
Okay.
ending at 5:30 London time, so it's actually longer than we thought.
Oh, shoot. Well, should I really messed up on the time thing. I needed some help from y'all. Apologies for that.
That's our mistake as well, sorry.
Oh, okay. So the question I have is, shall I, would folks like to see the answers, or should we just carry on? Yes, show the answers.
Describing the answers would be good. I don't think we should break
Okay.
out again, but show those in the spreadsheet briefly.
Okay, great. So let me, I'm going to stop sharing for one moment while I open up the answer sheet. Please give me just a second, and we are going to go over these answers. It's opening, but just very slowly. Come on. Excuse me. Sorry, having a little trouble. Okay, here we go. All right, give me a moment. All right, so I want to make it a little bit bigger so you can see it. All right, give me one moment. All right, so how many, while I'm sharing my screen, can the facilitators let us know, were you able to actually get to, can you see my screen now? Esther, can you see it? Great. So how many of you were able to get through some of this? Were you able to get to the expenditure data and coding form? Okay, thumbs up by Johnny, Esther, Amy. Okay, Hassan and I did, and I guess Alo did not. Okay. All right, so what you can see here is, again, just to go over this, this is where the action happens, the expenditure data and coding. As you may have heard from your facilitators, these 8 columns A, B, C, and D are coming from your raw expenditure data. And then you have an option to include or exclude that cost. Now, what you notice is we included costs related to the executive directory salaries, the consultation to develop a curriculum for poultry raising, motorbike services, petty cash for transport, for monitoring, printing business cards. We noticed on row 28, often our budgets have resources for our project staff and our researchers to attend conferences. Notice that we exclude this cost. Why? Because it does not directly relate to the implementation of the project and to the outcomes and outputs that we're expecting. Carrying on, we have training home volunteers, a venue for infant feeding. We have the health field staff salary. These are all included. And again, here you notice something interesting, the impact evaluation planning meeting. This is research. We're excluding that research cost. You notice that that what happens with the account codes when they are linked to our input codes, we have our input codes are automatically generated. These are the SEAMS nutrition impact codes. The Excel spreadsheet automatically generates US dollars from the local currency in column B. We use the allocation code type, and this again tells us how to allocate this information. Now, what you may not have seen is that in yellow, once you fill in columns A through K, what you get is this document will automatically generate cost by year and total costs, and it also allocates cost by activities in all of these columns. Now, this is pretty challenging to look at when you're actually entering data. You'd be checking these numbers, but what's really beautiful, as I mentioned, is that all this information links to this summary sheet. And again, you would use this summary sheet to check if your percentage is looking correct. Are there any outliers? So as you're entering data, you can be checking how do these data look when categorized by year, by input, by a period, timing, startup or recurrent, or by activity. Let me invite my facilitators to add anything to my comments on the expenditure data encoding sheet or the base summary sheet. Alo, was there something you wanted to highlight?
Thanks, Carol. No, just to maybe, reflect a little bit on the practical experiences we had. So like Carol was saying, once you're able to visualize these costs and the summaries by cost and by year, and the cost drivers by year, you can quickly go back and see, are these, when Carol was saying outliers, when you see percentages that are, for example, very different, that you don't know quite how to explain, then, you often start to unpack and go back to your data and kind of say, well, actually, maybe that accounting data for 2017 is incomplete. They've actually pushed a lot of that stuff into 2018 just for accounting purposes. But the percentages, so overall, makes sense, but the ones by year might not actually reflect what's actually happening. So it really requires you to understand exactly what activities were going on and how the accounting sort of is tied up to that activity. So that really involves quite a lot of discussion with the implementers just to make sure you understand everything.
Amy?
I was actually going to add on to that point, which is just the sheet is an excellent tool, but that doesn't necessarily show how much kind of work there is on the side to on the person-to-person side with really working with the implementer and getting key counterparts who can help you understand the expenditures, particularly someone in finance in those organizations who knows the account codes, who understands the expenditure descriptions. Sometimes the descriptions are pretty obtuse or they're in another language that you may not speak. So that relationship that you develop with those organizations is essential, I think, to making sure there's accurate coding there. And you may be working with multiple people, so it is a bit of a juggling act.
The other comment I'd like to make on this Excel file is we're giving you an example of a hypothetical international NGO, but in reality, you may have multiple partners and multiple organizations. You would like to fill one sheet per organization. And and then what you would do, of course, is you would combine these all together to get your unit costs. So again, there would be one expenditure data and coding file per organization. Are there any questions on this sheet on the process of coding financial expenditures or this tool? We realize, apologies for my rushing us on the training section. Any questions, please put them in the chat box. There are no bad questions.
And just to add, Carol, I think it's also important to know that this is sort of an iterative process. If there is an allocation code that you have to define in the middle of you filling out this spreadsheet, it's completely fine to go back to the different tabs and like update and, you know, add in an allocation code that may have been missing at the beginning, and make sure that, yeah, and kind of have it's a constant conversation with the team members to try best to estimate, you know, these costs and these financial expenses, and have, you know, validation calls with your team sort of ongoing, and make sure, you know, everyone kind of understands what's going on and the definitions are clear, that you're allocating the expenses as best you can and as correctly as you can. So yeah, just it's a very iterative process, I would say.
Great, thank you. So what I'd like to do now is invite Amy to actually talk about some of the practical experiences of data collection. If there are no questions, as Amy is now sharing her screen, I think. What's going on with mine? Okay, so over to you, Amy. You're muted.
Can you hear me? Great. So I'm going to focus on some practical challenges. You know, we want to present the tools and how you use them so you can really dig into that and understand the methodology, but we also want to be upfront about some of the challenges of doing economic evaluation and the challenges of costing. And that first challenge is really getting access to the data. That might be the first question you have in your mind, which is how do I get to that? So one question is, there is a cost to cost data. That cost can range quite a bit. We've found looking at those costs, a standalone costing study is much more expensive than a nested costing study. So if you're able to kind of co-plan with an organization that's doing the impact evaluation, or if you're part of that team and work with the implementers from the beginning, you can build in your data collection into that process. For example, you can take advantage of other means of data collection. You could take advantage of process evaluation data that might be measuring things such as beneficiary time allocation. So sometimes an organization will be looking to see how many hours a beneficiary how many trainings a beneficiary might attend. And so you can often be smart about taking advantage of existing data. And then of course, there are those questions of retrospective versus prospective. Retrospective cost data, you're going to have some recall issues. It's harder to obtain info kind of working backwards. But if you create that partnership with the implementer and get a champion and have them stick with you, you can often get those costs up front, like I was mentioning. Certainly another challenge is that organizations may be reluctant to share their expenditure data at first, particularly staff salaries. And a key component to that is establishing a clear agreement with them and establishing trust, showing them that there's an IRB, there's data confidentiality, that you're not going to be sharing individual names or staff salary data by those individual levels. Basically, you're looking at salary categories and making it clear that you're not an auditor. There may be a lot of misconceptions about the purpose of the costing work. Sometimes the implementers don't understand why, or for for what purpose you're doing this costing. So you're not the auditor, and you're also not the donor that's expecting certain types of donor reports. So I think it's very important to set up that relationship and make clear how the data will be used. In analyzing the data, you need, as we said, those counterparts who can help you explain the expenditures. As you see here, we have some of those raw expenditures, but you may not be seeing how many thousands of lines of expenditures you can sometimes have. So using those, automating those account codes can be a great help in that process, and having someone who can help you work through those codes can make things move a lot faster. And in our approach, we're wanting to make sure that you capture all costs, not just the financial costs. We did focus on that today to just understand the tool of the expenditure analysis tool, but getting those economic costs of beneficiaries and frontline workers, out-of-pocket costs, that's really critical in understanding the full picture of the intervention and its costs. In terms of presenting and sharing results, those questions, of course, the purpose of the SEAMS approach and methodology is understanding what are the major cost drivers. So it allows you to show program activities and program inputs, so you can use those comparative metrics looking at different types of programs, as well as cost efficiency for comparable unit costs. There are some questions that you need to think through in terms of how beneficiaries are defined in the program or households when you think through those unit costs and how you're dividing. Mapping those costs along the intervention typologies, as I described in my presentation, that can also be really helpful in lining up interventions and comparing them. Of course, there's always the challenge that organizations may not like the results if their programs look expensive and inefficient. But in the end, the purpose of this work is we think part of the purpose of the work is identifying really effective interventions and cost-effective interventions. So that's what we're moving towards. There are a couple COVID caveats. Hopefully we're moving past this, but in terms of costing, there have been some changes in IRB protocols, postponed or canceled surveys. So looking to how do you get that effectiveness data, being flexible about that, how to collect data during the pandemic. I'm sure a lot of you have already dealt with this, but certainly in terms of collecting those economic costs, figuring out ways to access frontline workers, particularly working through those program implementers is really the best way. They know what's going on the ground and how you can access people potentially by phone. And then also working with the data you have. You may be able to get really detailed expenditure data and then make a lot of headway with program reporting and to be able to understand how the activities break down. Great. And just to give another plug for the session on Wednesday, going deeper into the cost and cost effectiveness of programs and interventions. Thanks.
Thank you, Amy, so much. Well, we're fortunate. We actually have questions. We had a couple of questions in the chat box, which I can start with, but we would welcome some of your questions about any of the sessions today. So while I'm just going to maybe highlight a couple of the questions, please consider raising your hand, unmuting yourself, joining the conversation, or dropping something, a question in the chat box. But there was a nice question by Diana McLean on how commonly used is the SEAMS with project managers these days? And then objectively, should donors or grantees be suggesting this tool vis-a-vis other tools? So Diana, thanks for your question. The SEAMS nutrition framework is actually being developed and shared now. This is not necessarily a set of tools for project managers. So this is not a budgeting tool. This is intended to be used for costing, for capturing resource use, alongside other evaluation activities, maybe process evaluations, impact evaluations, randomized controlled trials. So it's really intended for costing, and that costing data should be used by project managers. The end result is very important. The cost shares, the cost profiles, the evidence generated is very important for project managers, but we don't expect them to be using it. You're right, our aim is to share these tools with donors to help promote their use for their investments in multi-sectoral nutrition programs. And in fact, USAID, Advancing Nutrition, and and some of their other nutrition investments have been promoting this tool. So we welcome other donors' interest, and we have seen it through GIZ and others. There was a question about excluding printing business cards from Regina Kamga, and a great observation. And Johnny answered that question saying, yes, you know, this is one of those ones where you might have to check in. What was the use of that business card? Was it essential for the entree to the local level, to the communities? Is it essential to implement the project? And so that's one is a judgment call. We have a question from Asha Khosravi. How could you account for incremental cost? For example, if the cost of a unit increased, decreased depending on the amount bought. So thanks for your question, Asha. An incremental cost is a total cost of introducing this new intervention or activity vis-a-vis what currently exists. Now, you might be thinking about how do you account for marginal costs or scale as you sort of expand the coverage, what happens to marginal costs or incremental costs. So if you're thinking about an input, you simply, you know, let's say you buy more vitamin A capsules or more fertilizer, you would simply use that input price, right? So we don't have to worry about that. So I'm not quite sure, you might want to clarify your question, Asha. I invite you to make sure I'm answering it correctly. No pressure, but you're muted, yeah.
Thank you for answering my question. No, I was just wondering that sometimes the cost of a unit is not changes. So according to how many units of something you buy. And so I was wondering how, and if the cost of the input changes, how from 1 month to another, depending on how much you bought, let's say, of that medicine, because maybe in the winter months you have a lot of influenza and you buy much more medicine, and then you get the unit cost, the price per unit less than if you buy less. And so that's what I meant.
Oh, thank you. Okay, so yeah, the unit cost could possibly vary over the year with seasonality, as you mentioned. So if you think that you're going to have seasonality of costs, then it's very important to actually collect data at those different points of time where you expect seasonal variation in input costs. So you might say if it's malaria and you have different demand for jugs or whatever, you would want to make sure as part of your study design to capture the data at different points in time where you'll have different variations in input costs. And you can use either the actual observed cost or you can average it and get a weighted average input cost. Great question. Anyone else want to take these questions? If not, I'll continue to. I don't want to, Amy, if you're interested, or Chris or Esther or Johnny, if you want to answer any of these questions, let me know. We have a couple more questions here. All right, so Josvat Moima asked, can these tools be used to evaluate a cluster randomized controlled trial? Absolutely, they're very well designed for that. And so as you're developing your protocol for your impact evaluation, your RCT, you can be also thinking about using this alongside of it.
And to that end, just to make an additional point, in some cases, for example, in the case with the Malawi intervention, we were able to take advantage of that design to be able to collect data that actually fed into the cost analysis. So, for example, in some CRCTs, you can collect time allocation data in your survey, or you could collect, as I said, beneficiary time. So there are some ways to work with that process, whether or not you're doing the impact evaluation or you're partnering with the impact evaluator. And Alo maybe can add a little bit to this, because we both worked on the costing and the impact evaluation of that program in Malawi, and to really try and be smart about utilizing that data for many purposes and fitting it in. And it's great to have other sources of data that can feed into your cost analysis.
Exactly, Amy. I think you answered it very well. And so did Carol, in terms of really, I think an RCT study lends itself beautifully to doing cost analysis, and for many different reasons. I think one of the reasons why I like to do that at the same time is to design an RCT for these complex interventions. You really need to unpack the program impact pathways. You really need to sort of get a sense of how the activities link to your effects. And that really provides a very strong basis for your costing work, right? Where you sort of break down your activity by activity and really go to the level of detail that you need. And then you sort of see, you know, how can I leverage my data collection schedule of my RCT, right? To plug in the different indicators that you need for your costing work too. And often a process evaluation, like Amy says, collects a lot of the data you'll be using as well. So it really makes it for a very cost efficient exercise, right? And, you know, with very little money, you can add a lot of value and help to unpack the sort of black box that these complex interventions often entail. So it really is a very complementary activity that can really provide invaluable insights. And a lot of the interesting part is a lot of these interventions often have these hidden costs that are often borne by participants or, you know, volunteers. And implementers don't really factor those in a lot. And when we were looking at those numbers in detail, you actually realize that the community actually contributes a huge amount of their own time and their own resources. So actually valuing that is really very important, also in terms of potential scale up, potential for sustainability, you know, all these factors that we know have become more and more important as we generate evidence on effectiveness. You know, how do we make these things you know, sustainable and really allow them to work beyond maybe the lifetime of the intervention. So costing work really can help you alongside the RCT in a very meaningful way.
Thank you, Alo and Amy, for those contributions. And of course, let me put a plug in for I'd like to put a plug in for the training website because in fact, we have a standalone protocol. It is ready to go. So I'm wondering, Esther, if you could put the link to the training website. I'd actually like to share it with folks as we're answering questions. And maybe, Esther, I'm wondering if I can invite you to actually open up the training website and share your screen while we're answering questions. And then maybe we can just show how easy it is to pull off materials, resources from this website. I'm going to answer some additional questions. We had a question from Hai No on what should we put into the sensitivity analysis? Great question. You know, we know that when using financial expenditure data, the question came up on what if your input prices change? And then we actually have a little bit of uncertainty, especially around microcosting and the representativeness of our data, especially in large projects when you may have hundreds of frontline workers working in 4 or 5 or 6 or 40 different districts, right? So how do you know that these costs are representative? So Hai's question is a good one in terms of how do we account for sensitivity analysis? So in answer to your question, once your analysis is complete, you would want to identify where you think you have the most uncertainty in your cost. You'd want to identify ranges, and you'd want to vary that. So you put the sensitivity analysis at the sort of at the end of this whole process that we've taken you through. And there are tools called Crystal Ball or At Risk that fit in nicely to this Excel template, and you identify the ranges and the distribution you're interested in, and the program will run itself and generate estimates, especially for cost effectiveness analysis, but also for cost analysis, and tell you how robust your results are. Thank you for that question. So,
Carol, can I add one thing?
Sure, totally.
Oh,
Yeah.
I was just going to say, in addition to kind of looking at that at the end of the process, it's also helpful if you can to anticipate variation while you're designing your data collection and sample. If you anticipate, we know we have these multiple cadres of frontline workers in different districts, and the districts are, some are close, some are very far from the capital. You may be easily able to anticipate where you might see great variation in frontline worker out-of-pocket costs or travel time, and be deliberate about how you're sampling some of that. So just to add on.
Thank you. Any other comments from Hassan, Johnny, Aulo, Chris on this question? Esther, can I ask you to go to the home page, if you wouldn't mind? Thank you. And I just wanted to mention, and if you scroll down, that on our website, we have some tools, we have some resources for you around what is costing. Maybe you can click that on. Since we have a little time and we don't have another question yet. So you can watch some videos to understand what is costing. We've also, I don't know why that's there. There's another video there. We also have some videos on what are economic evaluations. If you go to that tab. So these are generic resources. Oops, something is going wrong. I guess, Esther, you don't have access to all these wonderful things, or we'll have to test this. But, and then we have information on who we are, but also on the common approach. And we have all the training materials and the tools on this website. So this website, you have the link in the Dropbox. We would love for people to use it and provide feedback. I'm not sure, Abel, if it's on your economic evaluation, if it's, I guess it would be on the ANH Academy website as well. So there are training materials from past learning labs, which I highly recommend if you haven't watched them, more videos on practical applications. Thank you, Esther, for sharing that with everyone. Are there some additional questions? Your questions have been really great to help highlight important parts of costing and economic evaluation. Well, if not, I think, Zach, we could probably have folks answer the poll questions or the evaluation and give folks a little bit of time. I apologize to my co-facilitators for getting that timing so wrong. We lost 10 valuable minutes that we think you all would have enjoyed in your hands-on session. So we will, you know, better timing next time. Apologies.
Awesome. Yeah, I have the poll questions to evaluate the Learning Lab available. So I'm going to go ahead and launch that right now. So you should see that pop up on your screen. While you take a look at those questions and fill them out, I just have a couple of remarks that I wanted to give. Just to reiterate, thank you so much for taking part in this Learning Lab, and thank you to Carol and all the facilitators for doing this. It's just such an excellent opportunity to learn and work through all of this together. Please see our website for the other learning labs that will be taking place tomorrow and Thursday. We have a bunch of other learning opportunities for you all. And then, of course, reach out to us if you have any questions. I do want to put in the chat really quickly some other resources and opportunities that are soon to be available next week. And this is for, we have a new teaching resources webpage where it has links to all these online open access teaching materials, of course, centered around agriculture, nutrition, and health interdisciplinarity. So you'll see that link there. And we also would like to announce and introduce our mentoring scheme for members. And so you can take a look at that webpage to discover how to be involved. You can read career journeys from other researchers or other practitioners in agriculture, nutrition, and health, and see, you know, how people came to have the careers that they do have. So please take a look and let us know if you're interested or have any questions or comments.
Thank you, Zach. And again, thank you to all the participants and to the facilitators who I'm sure did a wonderful job in a time-constrained rapid session. All right.
Thanks, everyone.
Thank you, everyone.
Thanks, everyone.
Thank you.
Thank you.
Bye.
Bye.
Everybody.
Bye-bye.
Bye. Thank you.
Bye. Thank you. Thank you.
All right. I think I'm going to go ahead and end the. I think I can end it on my end, but yeah, I'll for the volunteers.
Debrief meeting in 15 minutes, but you can end it from your end. Thanks.